If you use hand sanitizer after touching a C. diff patient, you already failed the NCLEX. And it's not because you didn't study hard enough. It's because the NCLEX doesn't test what you know. It tests what you think you know. And infection control? That's where they trap you every single time. I've watched hundreds of nursing students miss the same questions over and over. Not because they're dumb, because these questions are designed to make you second-guess yourself. So let's decode the 3 dirtiest tricks NCLEX pulls with infection control. Trick number 1. The Hand Hygiene Trap. Here's what they do. They give you a question about C. diff, MRSA, or norovirus. 4 answer choices. One of them says, perform hand hygiene with alcohol-based sanitizer. Sounds reasonable, right? We use hand sanitizer all the time. Wrong. Alcohol doesn't kill spores. C. Diff has spores. Norovirus is non-enveloped. You need soap and water. But here's the trap. Your brain is so used to seeing hand sanitizer as the safe, correct infection control answer that you pick it on autopilot. The NCLEX knows this. They're not testing if you know what C. diff is. They're testing if you know the specific mechanism of how to kill it. So here's the decode. Anytime you see C. diff, norovirus, or the word spores, the answer is soap and water. Every single time. If the question says alcohol-based hand rub, and it's C. diff, it's a trap. Don't fall for it. And here's the kicker. They'll throw in a question where alcohol is correct, like with MRSA or VRE, just to mess with you. You have to know the difference. MRSA, VRE, COVID. Alcohol works. C. diff, norovirus? Soap and water only. Write that down. Trick number 2, the PPE donning and doffing order. Let me guess. You've been told 100 times. Donning, gown, mask, goggles, gloves. Doffing, gloves, goggles, gown, mask. Cool. You memorized it. Gold star. But the NCLEX doesn't ask you to recite the order. They ask you what you do when something goes wrong. Like this. You're caring for a patient with tuberculosis. You put on your N95 gown and gloves. Halfway through the procedure, your glove tears. What do you do first? Most people think, leave the room, change the glove, go back in. Nope. You remove all contaminated PPE, perform hand hygiene, redon everything, and then re-enter. You don't just swap out the glove. That's cross-contamination waiting to happen. But here's what makes it even trickier. The NCLEX will give you answer choices like A. Remove the torn glove and perform hand hygiene. B. Remove all PPE, perform hand hygiene, and redon new PPE. C. Continue the procedure and change gloves afterward. Or D. Ask another nurse to bring you new gloves. A sounds reasonable. C is obviously wrong. D sounds helpful, but B is correct. Because once you're contaminated, you don't half-fix it. You reset. The NCLEX is testing if you understand the principle, not just the steps. Here's the decode. Any PPE breach equals full reset. No shortcuts. And one more thing. If the question asks what you remove first when doffing, it's always gloves. They're the most contaminated. Get them off first. Trick number 3. The isolation precaution trick question. The NCLEX loves to mix up Airborne, Droplet, and contact precautions. And they know you get them confused. So they'll give you a scenario like this. A patient is admitted with bacterial meningitis. What precautions should the nurse implement? And you panic. Is meningitis airborne, droplet, contact? Here's the problem. It depends on the type. Viral meningitis, standard precautions. Bacterial meningitis, like meningococcal. Droplet precautions. Tuberculosis meningitis. Airborne precautions. See the trap? They don't always specify. And if you don't know the difference, you're guessing. So here's how you decode it. Airborne equals small particles, stay in the air, need N95. Think MTV. Measles, tuberculosis, varicella, which is chickenpox. Negative pressure room. N95 mask, no exceptions. Droplet equals bigger particles, fall within 3 to 6 feet, need surgical mask. Think SPIDER. Sepsis, specifically meningococcal, pertussis, influenza, diphtheria, epiglottitis, and rubella. Surgical mask, private room preferred. Contact equals direct touch or contaminated surfaces, need gown and gloves. Think MRS, WEE, MRSA, RSV, scabies, VRE, which is vancomycin-resistant enterococcus, and C, Diff, gown and gloves, every time you enter the room. Here's the NCLEX trick. They'll describe the disease without naming the precaution type. You have to recognize the pathogen and match it to the precaution. If you just memorize droplet precautions, but don't know that meningococcal meningitis is droplet, you'll miss the question. Now here's the part that makes students mad. The NCLEX will give you a priority question like this. The nurse is caring for 4 patients. Which patient should the nurse see first? A. A patient with MRSA who needs a dressing change. B. A patient with tuberculosis who is asking for pain medication. C. A patient with C. diff who has called for assistance to the bathroom. Or D. A patient with no isolation precautions who has a blood pressure of 88/50. Everyone picks D, right? Low blood pressure, unstable, see them first. Wrong. It's C. Why? Because C, Diff is highly contagious, and if that patient tries to get up alone, they'll contaminate the entire hallway. You prevent the spread of infection before you address a stable low blood pressure. The NCLEX is testing infection control priority, not just medical priority. And that's what messes people up. You think like a nurse, but the NCLEX wants you to think like an infection preventionist. So be honest, which of these 3 tricks has gotten you before? The hand hygiene trap, the PPE reset, or the isolation mix-up? Drop it in the comments. Let's see which one is tripping up the most people. And if you want more NCLEX decoding like this, hit that subscribe button so you don't miss the next one. Because passing the NCLEX isn't about knowing everything. It's about knowing how they ask it.